On this Wednesday night, the push to fully vaccinate vulnerable Canadians sooner.
They're particular sitting ducks right now.
How some provinces are speeding up plans to give out the second dose. Europe's plan to open its borders to the fully vaccinated.
Thank you to the Portuguese government. Up the vaccine.
What it could mean for Canadian travelers. Doctors' orders the multiplying calls to call off the Tokyo Olympics. And
I call it a Cicada Palooza.
They're back.
They're going to fly to the treetops in the big romantic party in the sky.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with a question that's emerging as more and more Canadians get a first dose of COVID-19 vaccine. When will they get the second shot? And will the 4-month interval between doses be shortened? At this point, 17.8 million Canadians, or 47% of those eligible, have had at least one dose. Only about 1.4 million people, though 3.9%, have been fully vaccinated with both shots. The provinces had agreed to extend the interval between doses to 16 weeks to get more people a first dose as fast as possible. Now, with millions more doses arriving, some provinces are accelerating plans to get people fully vaccinated.
Today, we're announcing that the booking of second doses will launch this Friday for individuals with specific health conditions.
There is a lot to look forward to once second doses are rolled out. That's especially true for Canada's elderly. Mike LeCouture has our top story tonight.
I've done everything on this truck myself.
81-year-old Russell Downey has been spending a lot more time tinkering with his old truck. With just one dose of the COVID-19 vaccine, he limits how much he runs errands. And his granddaughter prefers it that way.
It's very, very frightening every time I hear him going to get groceries, because I have to think of where did you go? How many people have you interacted with?
Russell isn't as worried.
I'm wearing gloves and a mask, and I disinfect my hands as soon as I come out of a grocery store. I have a bottle in my car all the time.
They're particular sitting ducks right now for getting COVID-19 and dying.
While most Canadians living in long-term care homes have been fully vaccinated, Dr. Samir Sinha says there are close to 9 million elderly Canadians who live independently and aren't fully protected.
People, who are 80 and older, the ones who have the greatest risk of dying, we know that they don't mount as good a immune response to that first dose.
Statistics show less than 20% of that age group have two-dose immunity. Among Canadians 60 years and older, less than 7% have received both doses.
Elderly Manitobans will be able to book their second doses before younger ones.
Manitoba is focusing on high-risk groups with second doses, while Saskatchewan is shortening the interval between doses from 16 to 13 weeks. Other provinces could follow suit. Some doctors believe we can hand out more first doses while also reaching vulnerable populations with second doses.
There's individual protection, population level protection. We can find that sweet spot where that Venn diagram overlaps. And because we actually have so much vaccine coming into the country, and we can likely vaccinate both.
Shannon Downey hopes he's right, and until he gets his second dose, she wants her grandfather to stay safe by staying home. Mike LeCouture, Global News, Ottawa.
As provinces work on rollout plans for second doses, there's some new flexibility about storing the Pfizer-BioNTech vaccine. Health Canada now says it can be stored at regular fridge temperature at the point of use for up to 1 month. The previous rule was 5 days. Pfizer had submitted a request to change the storage restrictions because it's been collecting longer-term data about the vaccine's stability. Well, vaccines are key to relaxing public health restrictions and opening the door to the possibility of going on vacation. The European Union said today it is ready to open up to fully vaccinated visitors. The plan still needs final approval. Details are still being worked out, though some countries have already said they won't require quarantines or testing if travelers are fully vaccinated. French citizens got back to sipping coffee and wine at cafes and restaurants for the first time in 6 months. Non-essential retail shops were also reopened. Customers turned out in droves. They also lined up to be the first inside museums like the Louvre. Could that be us? Abigail Bimman looks at what the EU's plans might mean for Canadians.
Iconic beer gardens and Viennese coffee houses, Austria is one of the latest European countries closer to a normal summer.
Cheers. Thank you to the Portuguese government.
On the whole, EU nations agreed to expand the list of safe countries allowed to visit them.
This will help progressively resuming international inbound travel where it's possible to do so safely.
While the details are being ironed out, Canada is not likely to make that safe list. It will require countries to have fewer than 75 cases per 100,000 people in the last 14 days. Canada currently sits at 232 cases. But Canadians could still have a European vacation if you've had both doses of the vaccine at least 14 days before you travel.
We are very likely going to be able to travel abroad, depends where. The question is not can we, but should we?
Dr. Christopher Labo says people should avoid parts of the world with high COVID rates. Elsewhere, for those vaccinated, he says the risk is very low, but not zero, so be careful to avoid ending up sick in a foreign hospital. Across Canada, summer vacation may be a safer bet.
I think the most likely explanation is that by July, August, case counts will have decreased far enough that most provinces will not have travel restrictions.
And as far as our neighbors to the south, so far no changes to visiting the U.S. and vice versa, no matter your vaccination status.
We'll see what framework we apply to ensure that we're keeping Canadians safe, even as we look to eventually changing the restrictions and the posture at the border.
And no matter your international vacation destination, when you return home, you still need to quarantine for 2 weeks, with up to 3 days in a government-approved hotel if you've arrived by air. At this point, the government has nothing new to say about when those restrictions will lift. Abigail Bimman, Global News, Ottawa.
There is no relief from restrictions yet for people in Nova Scotia. That province has extended its shutdown until at least the second week of June, and students will not be back in classrooms before the end of the school year.
The new case numbers continue to be too high, and the number of people in hospital continues also to be challenging. We need to get our case numbers much further down before we can begin slowly reopening.
83 new infections were reported in Nova Scotia today, and 2 more people have died. Japan is battling a spike in cases that threatens to overwhelm hospitals there just weeks before 15,000 athletes arrive for the Summer Olympics. Japan's problem is not unique. Many Asian countries are dealing with dangerous outbreaks after appearing to have the virus under control. And as Eric Sorensen reports, they also share a troubling trend in vaccinations.
They were the success stories. Taiwan kept COVID out almost completely, but new variants have slipped in and spread. Hong Kong and Singapore have postponed a quarantine-free travel bubble. And Thailand is rushing to vaccinate after more COVID deaths in the last 3 days than in all of last year. And then there is Japan, which confronts a unique predicament. COVID case numbers have jumped to the highest levels in 4 months as Tokyo stages events preparing for the Olympics in just 9 weeks. Already reduced in scale, the games are increasingly unwelcome in Japan. Thousands signed an online petition to cancel them. A major medical association says there aren't enough doctors and nurses to spare for the Olympics. I believe it is impossible to hold the Olympics safely, says this top doctor. Japan is a victim of its own success. It didn't need vaccines at first, and now less than 4% have received shots. The athletes will increase the infection risk, says this protester. The IOC is desperately trying to reassure the host country.
This full commitment of the IOC to organize together safe Olympic and Paralympic Games for everybody.
Canadian wrestler Erica Wiebe is training, still hoping the games go ahead.
To stay mentally and physically healthy, it's been an unprecedented challenge for Canadian athletes like myself.
But others question the wisdom of staging the Olympics during a global pandemic.
Get a whole bunch of people from all over the world to travel to one place, mix in close quarters, and then go back again. That's a recipe for making things worse.
A former Canadian rowing silver medalist says ultimately it should be up to the Japanese people.
If the people that are at the greatest risks for these games feel that they should not go forward, then they should not go forward.
A new poll finds more than 80% of Japanese don't want the Olympics to go forward. Eric Sorensen, Global News, Toronto.
95 athletes from India have qualified for the Tokyo Games, but training is being hampered by lockdowns and travel restrictions. India reported over 4,500 deaths from COVID-19 today. That is more than any other country in a single day at any time during the pandemic. New infections are also spreading rapidly. India confirmed over 267,000 cases today alone. There's talk of a possible ceasefire at some point between Israel and Hamas, but tonight there's no sign of it. The U.S. President Joe Biden has called the Israeli Prime Minister again, this time saying he expects a significant de-escalation in violence on the path to a ceasefire. Benjamin Netanyahu says he's determined to carry on with the attacks until Israel's aim is met. For a 10th day, Israel kept targeting Gaza, and Hamas kept up rocket attacks on Israel. Most were intercepted by Israel's Iron Dome defense system. Israel's medical service says 12 Israelis have been killed now, including 2 children. The toll in Gaza is almost 20 times that. Gaza's health ministry says at least 227 people have been killed, including more than 100 women and children. Redmond Shannon reports.
A phone call from Israeli intelligence warning residents of a Gaza street to clear the area. Moments later, an airstrike hits. Another building obliterated. Damage across the neighbourhood. No deaths here, but at least 9 more Gazans were killed Wednesday. Israel says it's killed more than 150 militants since May 10th, but doesn't detail the innocent people who've died.
There is no army in the world that does more than the Israeli army, and the Israeli security services, and Israeli intelligence, to prevent collateral damage.
Benjamin Netanyahu's walk and talk news conference made no mention of rumoured ceasefires. Instead, he stressed Israel's efforts to play by the rules.
There are probably children there, so we're not going to do it.
Gazan authorities say more than 60 children have been killed since May 10th. The NGO, the Norwegian Refugee Council, says 11 of the Gazan children it's been treating for psychological trauma have died in airstrikes. US President Joe Biden spoke with Netanyahu again, saying the United States expected a significant de-escalation Wednesday on the path to a ceasefire. Shortly afterwards, Netanyahu, who is currently clinging on to his job in a hung parliament, said he is determined to continue until peace in Israel is restored. In other words, as long as rockets from Gaza have Israelis running for cover, Israel will keep firing back. Redmond Shannon, Global News, London.
New calls for justice coming up. The Canadian professor being ordered to stand trial again in France. There is an update tonight on the military investigation into the former head of Canada's vaccine rollout, Major General Danny Fortin. Canada's military police now say they've referred their investigation into an allegation of sexual misconduct to Quebec's prosecution service. It's now up to the prosecutor's office to decide whether charges are warranted. Fortin left his role with the vaccine task force last Friday. After it emerged he was under investigation, Fortin denies the allegation. The fate of an Ottawa professor is in question again tonight. A French court has upheld a decision ordering Hassan Diab be tried in the 1980 bombing of a Paris synagogue. As David Aiken explains, it's unclear whether or not Canada will be asked to extradite him a second time.
Dark moments.
Hassan Diab had already been extradited from Canada to France once, back in 2014, even though France never charged him with any crime, and yet he spent 3 years in a maximum security French prison, much of it in solitary confinement, until, in 2018, a French court released Diab, ruling there was not enough evidence to charge him.
That's pretty shocking, I think, and should be troubling for any Canadian to know that the bar in our own laws is so low that any nation that shows up with practically no evidence at all can nonetheless seek our extradition and succeed.
Now, France's highest court overturned that 2018 ruling, clearing the way for a new trial date. Diab, now 67, and his wife cannot believe it.
The family is devastated, and they understand that there is no evidence.
And the courts have failed to deliver justice at every single turn, through 2 levels of court in Canada, through 3 levels of court now in France. And there comes a point where enough is enough.
I think for Hassan Diab, we have to recognize, first of all, that what happened to him never should have happened.
That was Prime Minister Justin Trudeau 3 years ago. Asked 2 months ago if he would protect Diab from any future extradition, Trudeau was more circumspect.
We have continued to engage with officials in France on this case, and we will continue to.
Trudeau wasn't speaking to reporters today, but his Justice Minister, David Lametti, released a statement, and he said, because the matter is before the courts, no comment. Donna?
All right, David Aiken in Ottawa, thanks. Still ahead, the nurses putting their lives on hold to help Ontario through its 3rd wave. A team of nurses from across Canada is helping exhausted colleagues in Toronto hospitals. Thanks to the Canadian Red Cross, nurses from Alberta, BC, Quebec, Ontario, and the Northwest Territories have flown to Toronto to lend a hand in 3 hospitals. Karen Lieberman went to one ICU to find out what difference they're making.
So every day I've been here, nurses have taken on double patient loads. The patients just need a lot. They're very sick, and there's a lot of them. ICU is exhausting as it is. COVID pandemic, it's just like tenfold.
That's why Britta Jensen is here in Toronto from her native Vancouver, deployed by the Canadian Red Cross to help.
So I've been an ICU nurse for 8 years now. I've worked 3 shifts here. I feel like I've been working for a month.
When the pandemic started, Jensen was home on maternity leave but felt compelled to help her nursing colleagues, so she reached out to the Red Cross.
I was working in long-term care homes, helping provide public health support to them. I worked in federal prisons for a little bit, and then worked at the border doing testing for a few weeks. And then the call came that they needed nurses that could do ICU support.
A major concern throughout the 3rd wave of the pandemic has been the pressure on intensive care units and a shortage of skilled nurses to help care for the rising critical caseload.
I applied essentially thinking I was doing vaccinations because I work for Doctors Without Borders and I did a lot of vaccination campaigns.
Instead, longtime trauma nurse Nicole Desi was also deployed here to Humber River Hospital.
So for me, it's more just like how busy it is, like how sick the patients are, how young the patients are, the amount of resuscitations that I've seen here.
21 years working in ICUs, and this nurse was on the verge of retirement. But those plans were put on hold.
I need to help my colleagues. I need to help the public.
She worked the front lines during the SARS outbreak and H1N1 pandemic. But COVID-19 is unlike anything she has seen before.
It's very sad being in a situation like that. I will go into the end to help. I go into the end.
A team of nurses providing relief in a time of need. Karen Lieberman, Global News, Toronto.
This year's Cicada Palooza. Next, a taste of an explosive bug event. You've no doubt heard by now about the explosion of cicadas in parts of the United States. And when I say explosion, I am not exaggerating. There are trillions of the very loud winged insects. And for some reason, our Washington Bureau Chief Jackson Prosco volunteered to go and see them for himself. Apologies if some of the images give you the heebie-jeebies.
They said there would be cicadas. They weren't kidding.
We knew that it was millions, but sometimes millions just sound like a little bit too much, right? But then you actually see them and it's like, okay, yeah, there are millions.
This is my Super Bowl. This is what I look forward to every 17 years.
Entomologist Mike Ropp took us on a tour of cicada country, where right on cue, they've come crawling out of the ground.
We can still see some of the nymphs emerging.
They shed their exoskeletons and make their way up the trees looking for love. And that's where they sing. Millions of male cicadas in chorus, hoping to attract that special someone.
They're going to fly to the treetops to join their brood mates in the big romantic party in the sky. I call it a cicada palooza.
After laying eggs that drop back into the ground, the adults die off. Their sheer numbers are all about survival of the species.
That's their whole life, to be a clumsy bug with lots of them out there to overwhelm predators and still leave millions around to survive and reproduce. That's just so cool.
Today's cicadas have been underground since 2004. They missed the arrival of iPhones and Facebook, yet their plight feels more relatable than ever.
They've been social distancing for 17 years, so now they're coming up and out. You know, they're meeting their other fellows. They're meeting the other members of their species, just like us.
And like any good reunion, their rare arrival calls for a special meal, one where cicadas are the main ingredient. Chefs are buzzing about the chance to whip up a cicada stir-fry or cicada pizza. And don't forget dessert.
These are the cicada cookies. Slow roasted is apparently the preferred cooking method. Let's see how this goes.
Jackson Prosco, Global News.
It's kind of crunchy.
Columbia, Maryland.
Can't watch that. That is Global National for this Wednesday. Tonight's Your Canada starts with an apology to the Mayor of Toronto. I'm sorry, we don't want to pile on, but John Tory's hair is a sign of the times. It's what happens when hair salons have been closed since December. Some say it looks regal. Others say it's reminiscent of Beethoven. And people want to help.
Is this a Samson situation? Will he lose his strength to be mayor of Canada's most populous city if his hair is cut? We don't care. Somebody just needs to give that man a haircut. Do your part to help end the lockdown by getting vaccinated and wearing a mask when you need to.
Tory responded, thanks, whatever it takes to get people vaccinated. He's a good sport. Take care of yourselves. Bye-bye.